Good afternoon. Thank you very much for inviting me to speak to you today about artificial intelligence, ethics, and the role for causal inference. I'm going to cover a lot of ground in this talk fairly quickly, and so I want to make sure that you have available resources because I'm trying to spark some curiosity here, and those are listed in the last parts of the slides, as well as a link to where you can download the slides. As you know, and as you've heard in this conference, we're at a peak of enthusiasm about AI in healthcare. There have been some 27 approved products so far by the FDA. There may be more by now for clinical decision support and diagnosis and devices. It's being incorporated in computer vision for reading of radiographs and CT scans, et cetera. In workflow and the automation of administrative aspects of medicine, as well as in predictive modeling, risk stratification, and a whole variety of other more scientific uses in medicine. A very exciting time indeed. So what is artificial intelligence? And really, for the purposes that we're going to talk about today, it's about classification. The particular focus that I want to take is artificial intelligence that involves classification. And that is something a pneumonia or not a pneumonia? Is it malignant or benign? Or it could be classified into multiple classes, but we're going to simplify this by thinking about it in two dimensions, if you will. And we're going to be thinking about red balls and blue balls for a minute. And they can represent anything that you're trying to classify. And as you see here, simplified into two axes, an x-axis and a y-axis, there's data and information about these various red balls and blue balls. And we can draw a simple line that separates them fairly well. It has a certain amount of residual error, if you will. But when you take a set of data and train the algorithm on that data, and then validate with different data, it more or less is overlapping, which is great, except you'd like it to work a little bit better than this. If you really went to the extremes and tried to do and lower the error to as much as you could do that, but it would vastly overfit by making this line not a straight line, but a very squiggly line. And when you ran it on different data, it wouldn't validate at all, and there would be a tremendous amount of error. So what we're trying to do in prediction and AI is to really balance, to get the biggest separation between these red balls and blue balls that's reproducible. And what's important about this is it is not just two dimensions, but it really is, it can be hundreds of different dimensions of data that are used, but it's easy to look at them in this way. So again, a different way of looking at training and testing using a dermatology model. As a dermatologist, I tend towards these. You train by essentially subjecting an algorithm, and we'll talk a little bit more about what the algorithm is, to millions of examples, if you have them, of training data that are labeled malignant or benign. And the algorithm learns how to distinguish malignant or benign. And then when you take a separate set of data, test data, and you give it this unlabeled test data, it's able to relatively accurately distinguish malignant and benign, sometimes as good as or better than a lot of specialists in a particular field. And it does this by a really interesting way. This is a trained algorithm. It feeds in different pieces of data. This is different sections of the image, and this is again an oversimplification, into these nodes, which then take the data and put it into a mathematical form, if you will, and communicate it with a whole layer of other nodes. And you can see that each node here is communicating to all the other nodes in the next layer and the next layer. And this is a simplification because there can be dozens of these different layers, and there can be 25, 50, even 100 nodes in a particular layer. And then eventually this information is distilled down into a single decision: melanoma versus nevus, malignant versus benign. A lot of math happens here. When mistakes are made in the training, there's a signal sent back in this pathway that changes the weights by which these are all added up. This works almost like a regression. There is data and weights assigned, they're added up and then transmitted from node to node to node. It's a fascinating process that goes beyond where we want to be today in this discussion. But what's really interesting about it is you can do incredibly well at training. But for puzzling, explainable reasons and sometimes unexplainable reasons, a highly trained artificial intelligence can make some really strange mistakes that people wouldn't make. For example, this AI has been trained to see this as a panda. This is its conclusion, not with huge confidence, but with the addition of what you would see as completely random noise, and is completely random noise. There's an effect of sharpening. It looks a little sharper, actually, as a result of the addition of the noise. But it now says that this is a given, which is an incorrect answer with a 99.3% confidence. So what's interesting about this is we don't necessarily understand why it called it a panda and why it called it a given. And you can think about how nefariously somebody could add information that could change an AI in a way that is quite dangerous and we wouldn't want to happen. So some of the mistakes that happened are those that people also would make, but that they really shouldn't. And what we're talking about here is something that's been pretty highly publicized over the last, I would say, 5 years. There have been a number of books written about it. I have reference to a couple of them in the back. That is that artificial intelligence applications, sometimes in medicine, in criminal justice, in where Amazon sends its trucks, et cetera, for same-day delivery, in lots of different settings, there has been racial and gender and ethnic bias that has been incorporated into these algorithms that are quite disturbing, because the algorithms are being used to make decisions. And this is the most important aspect of this. They're being used to make decisions in society that can advantage or disadvantage particular groups. And in a way, when they do that, they potentially can amplify and worsen the bias situation, not in any nefarious way, but because of the data that they're being trained with. And we'll speak about that. Here's an example that a lot of people use, which is the Turkish language is a gender neutral language. And when information about it is a doctor or it is a nurse, let's say, are fed into Google Translate, and this, of course, has been changed since it was discovered. Google Translate some time ago came out with he is a doctor and she is a nurse, obvious gender bias. It went down a number of occupations and gave the same kind of results. So this wasn't just a one-off issue. And it was, in fact, that the data that was used to train it was biased. So let's talk about that a bit, because in artificial intelligence, the bias that you see often reflects training on data that encapsulates existing societal bias. This is a very deep topic. That's not the only reason that algorithms can incorporate bias, but let's talk a little bit about them. First of all, the labels themselves can reflect human bias in prior actions. If there was a bias in, let's say, the sentencing of particular people for crimes that was based on race, if the labeled data that you're using to train that algorithm has that bias incorporated into it, the algorithm is going to learn that as long as it has some information about the race of the person that they're learning it, or other information that where race can be inferred. Similarly, gender, ethnicity, etc. Another way that bias can be incorporated is in the accuracy of the predictions for particular groups. And this is really important because data, it's often easier to get particular ethnic groups to participate in certain things. Let's say genetic testing, for example. And what happens is that when your database is composed of people from that ethnic group, conclusions that, or race or gender or whatever, the conclusions from that data that are made through artificial intelligence or otherwise may not be applicable to Asian populations or Hispanic populations, et cetera. So this is a significant issue in terms of selection bias, if you will, from the data that are being used. Another way that this kind of bias can be incorporated has come out in some algorithms that were actually created to predict cost in healthcare from one year to another. That's an important question. If you want to know how much cost somebody is going to be for a particular year, you can use data from a prior year. But when that information on cost is incorrectly applied to predicting future health, you now get a confusion of two topics. And what happens is if you have one societal group that has a tendency to have lower cost, the assumption that that means they had better health is incorrect. And so if you're predicting their health based on their cost for the next year, you actually are predicting better health than they actually might have. And that kind of bias can lead to serious inequities in the delivery of care, in the delivery of preventative care, and can even amplify those issues for these particular groups. So what can AI prediction do and what can it not do? Well, AI prediction, and this goes all the way back to regressions and a lot of things that might be called machine learning, or even you might even not think of in terms of machine learning. Prediction can predict a result in a specific task based on data. They can predict a state. They can predict whether someone is likely to get sick or not get sick, or whether an image represents, again, retinal proliferation or not, indicative of a complication of diabetes. It can continuously learn from the data, and that's something that artificial intelligence, specifically the deep learning programs, are particularly good at. And it can see invisible things to human observers, and sometimes those are really valuable as positive, sometimes, as you saw with the panda example, negative. They can also point us to factors that were important in the predictions, and this is relatively new, but it's very important. Transparency, explainability, understanding why the predictions were made. But AI cannot know when the data or labels are biased or wrong or highly selected, the things we already talked about. It can't know whether it's being used properly on the right people. Again, something that refers back to that selection bias. And now it can't determine which inputs cause the prediction. And we're going to really focus on that now. That's why it's in bold. And it can't estimate the effect of changing a particular input on the outcome. And that's an effect of causality, if you will. So when do we want more than just prediction? Let's give you an example. Within a health system, having a bed in a particular ICU may be a predictor of sepsis. The ICU is associated with sepsis. This could be a surrogate for the patient condition. A particular ICU might get particularly ill patients compared to other ICUs in a system. It might represent the quality of care in that ICU. It might represent the presence of a staph carrier in a particular ICU, or a bunch of other factors. If all we're doing is predicting, we don't care if we want to know whether there are worse or better outcomes. But most of the time, we don't want to just predict outcomes. We want to identify the causal factors from amongst the predictors. We want to know whether there's a quality of care issue so that we can change that. We want to know whether we need to treat our staff with mupirocin or something, nasal mupirocin, to avoid that staph carriage. Or we want to know and be comfortable with this because it's just a confounding factor, that is, sick patients happen to be in that ICU. So causal inference allows us to take actions. Causal inference means inferring the effects of an exposure, a treatment, or a policy on an outcome, and separating that from just an association of an exposure, a treatment, or a policy on an outcome. What we mean by that is something Judea Pearl described as, if B is a cause of A, then B listens to and can respond to A. Think about that. If B listens to or responds to A, then A is a cause of B. Another way of thinking about it is counterfactually. If A didn't happen, would B have happened? Those are two different ways, and there are other ways to think as well. Causal inference has been developing for many decades in epidemiology, statistics, social sciences, and philosophy, but recently, a number of methodologies have made it possible to use causal inference in a mathematically rigorous way. And I'm going to show you just a couple of those. So again, causality cannot be determined from the data alone. It requires reasoning and expert input. And that's a very important point. We can put causality into artificial intelligence by understanding what the key variables are that underlie an AI determination, and by putting a human in the loop to interpret and act on AI. We can also insert expert knowledge into AI using directed acyclic graphs, which are called DAGs. I'm just going to show you a quick example of that, and a whole variety of other things, which I'm not going to cover, but are covered in detail in the references at the end. First of all, here's an artificial intelligence application that determines whether someone should have an inpatient stay or an observation stay. And it highlights the reasons in darker and darker yellow why it decided, and this is an abstracted information, it's not sentences, but it highlights the information from a medical record of why, allowing someone who's reading it to make a decision about whether those highlights make sense or don't make sense. That's one way of inserting explainability into the data. This is a DAG. Some of you are probably quite familiar with this, a directed acyclic graph. This is one of the innovations that was developed by Judea Pearl. Each arrow that you see from one thing to another is a causal arrow, and we're trying to determine whether vitamin D supplement actually can influence whether you get severe COVID-19 or not. And this is something I just made up. This is in a program called DAGity in R that actually shows you the factors that you have to adjust for in an observational study, which in this case would be either race, ethnicity, age, and comorbidities, not adjusting for all the other things, or pre-vitamin D level if you had actually measured that in everybody. But if you adjust on mortality, you're making a mistake, and you actually are going to connect these two things. That there's a ton you can learn by about causality, but what's important is that these kind of understandings, by drawing out your understanding of what all the causal factors are, allow you to actually look for them and determine them in the results of causal inference. And we'll talk about that as interpretability, which is if you are getting input data, the algorithm gives you an answer. Why did the algorithm do that? Can I trust those results? How can I correct the error? So you'd rather have something which had an explainable model associated with it and an explainable interface so that a domain expert can understand why the model made a particular decision. They can, the domain expert can learn and correct the errors in the model and adjust the model, and they can reenact the model on demand. And there's, this is one way to do this, and it's really important nowadays for an expert to actually review, for the model to be an advisor rather than the expert itself. Sometimes that's not possible. For example, in split decision decisions in a self-drivable car, but we all know that there are issues related to that. And finally, accountability. And I'll leave you for a moment with this slide, as it is self-explanatory. But it is a real issue, which is that in the end, it has to be the people. It has to be the people that make the mistakes, if you will, or don't correct the algorithm's mistakes, that are responsible. So in conclusion, the ultimate goal of artificial intelligence is to enable actions to improve outcomes. Causal inference in artificial intelligence allows meaningful actions. Currently, the best way to insert causal inference is to put humans in the loop. Human review can also correct data and algorithmic societal bias that we've already heard. And active research is underway to better deploy computational causal inference in artificial intelligence, which goes beyond this slide, this talk. I'm going to just show you 3 slides again, and the link I'll leave on for a while. So if you're interested in good places to start, there's a book, Rebooting AI, which will give you a layperson look at this. Judea Pearl's Book of Why actually incorporates a lot of causal thinking, but it's intended for lay audiences. And Artificial Intelligence in Healthcare is a book that I'm a co-author of that the National Academy of Medicine did. If you want to understand more about ethics, a good place to start is Cathy O'Neill's book, which is Weapons of Mass Destruction. I've actually, unfortunately, cut off the title on here, but there are, at this link, a bunch of books that are similar to that. And then a deeper dive into causality, some of this book by Judea Pearl, another by Miguel Hernan and James Robbins, a course that's ongoing this fall that's wonderful that I'm taking, and the Causal Inference podcast from a local epidemiologist. And my slides for this talk are available at this URL and will be available for a period of time. So I want to thank you very much for inviting me here, and I will say goodbye.